Thank you so much for staying on the AM show. Like I mentioned earlier, this morning we are having a conversation about HIV/AIDS, funding, campaigning, the statistics, and every other thing you want to know about it. It's because funding for HIV response has been, over the years, dependent or over-dependent on international sources. The AIDS Commission reports spending $323 million between 2019 and 2021 on funding. So this morning, the question we are asking is, what's the status of our fight against the virus and how do we address that funding gap? I will be having that discussion shortly. But before that, 20 years ago, she began the journey of realizing her dream of becoming an officer with one of Ghana's security agencies. But that dream was cut short after she was diagnosed with HIV. Gifty Tokonu was sacked against medical advice and had to face the world all alone with her 9-year-old daughter. In the following report, Ernest Menu of our health desk tells her story and how, as a single mother living with AIDS, she's dedicated her life inspiring hope and campaigning against stigma.
16th April will forever be etched in the mind of Gifty Tokonu. She received news that changed the entire course of her life.
The school organized the blood donation to Kolebu Blood Bank. So a week or two later, our then director of study ordered all of us who could not donate to avail ourselves for sugar diabetes test, which we all avail ourselves. So when the result came out, I was told I was not having diabetes. But he asked me not to go. When I entered the office, he wasn't there alone, he was there with another officer. And she just threw it into my face that, Gifty, I'm sorry to tell you, you have HIV.
She was utterly devastated. Gifty was only 6 weeks away from graduation that would see her start her life as an officer with one of the security agencies. But that dream never materialized when the security agency informed her that they cannot employ her because of her HIV status.
So I decided to confirm it. So I chose Police Hospital. So after the test, she told me that, Gifty, you tested positive. My brother, it was eclipse of the sun. I wept, I don't know how many buckets of water that I got tears. So she allowed me to, she asked me to flow. I cried, and when I was okay, she gave me the post-test counseling. But then there was nothing like antiretroviral. So all she told me is that I should just eat well because there's no medicine. She gave me 2 envelopes. Said, this is your result. It's yours. Don't give it to anybody. But take this envelope and give to them. 19 years now, what I can remember is that the end tail of the letter, she said, our client is strong and healthy. Don't do anything stupid to her. She used the word stupid. So I said, okay, since she's not asking them to sack me, then I have the room to go back. Immediately I got into the training school, he spotted me. So he asked me to follow him to the office. I did follow him, and what he told me was that order from above said you should go home. On what basis are you asking me to go home? Order from above said you should go. You are a recruit, listen to me. No written letter. I went home by verbal instruction.
The strong stigma and the fear of death consumed her. She then decided to end it all immediately.
Life became so difficult for me now. I have nothing to lay my hand on. My work has been taken away from me. Now, calls to disturb me with others. So I concluded that let me take my life. A few days later, I prepared my own concoction, which I will not disclose. Just want to leave this world and be free. So I took it, but I went to sleep. Nothing happened. If not today that I'm telling you, no one knew I tried taking medication to kill myself because I was tired of this life.
But after this failed attempt at suicide, her life took another turn. A radio show on HIV on Joy FM will be the trigger for her open disclosure of her status and her new life as an HIV ambassador.
I think 2007, there was HIV Deba, World AIDS Day at Obra Sports. And when I was going on my way, I was in Odoko Trotro, that long bus, and in Joy FM. Joy FM was discussing about HIV on a very negative manner, which I got angry in the car. I took my phone and then called and then blasted them about how they were saying. In fact, the way they were discussing it, it looks as if everybody that gets HIV is being immoral and stuff. So that is why I attacked them. But I was on my way going to the Deba. So when I got to the Deba, our then president wanted someone to disclose to the public for people to know that if you have HIV, you don't look that sick that people think. Everybody refused. And I don't know, I was just carried from the chair and I moved to the podium and I spoke. And I finished doing it before I realized that I did something. So when I did, somebody was among the crowd, spotted me. And they came to me and said, asked of my name, I mentioned my name, you'll be a good material. I didn't understand what the person said. In 2010, I was there when Ghana AIDS Commission called me that they would like to engage me in ambassadorial work. In fact, it was a bit tough for me, but I said no. I have to do something for myself.
Gifty has since then dedicated her life to the work of advocacy, encouraging people living with HIV to live and achieve their full potential, especially women. She would later find love again in the place she was initially shunned, her church.
One Friday, I went to evening mass and I was going for communion and I realized everybody was running fast to go for communion before me. I said, this is too much. And then when we come out, you see people grouping, they'll group in a small group. When they see me coming, then they spread. I said, So my mind started telling me that these people were discussing me. So I went to the priest and told the priest that this is what I am suspecting people are doing to me. And I wouldn't leave the church because of them. So he asked me, Gifty, what do you want us to do? I said, Father, give me the altar to talk to them. He said, can you? I said, I've already come to TV. So the altar, yeah, it's not a problem. During the homily, the priest said he's not ready to give homily today, that he wants somebody to give homily. So he sat for 2 minutes, nobody stood up. And then he stood up and told the crowd that, okay, one of us, a lady, would like to give homily. He said, hey, lady. And then he mentioned my name, come and see the chapel. As if we were in the markets. I stood up and then I gave them the story of how I got to know my status and how people started maltreating me in this church. My brother, men were weeping in the church as if they were beaten. In fact, the then Director General also came out, spoke and then educated the crowd, and that ends that discrimination in the church.
When it comes to stigma, the church, families, society, all of us, we have a role to play. She is one of us, our own. So imagine we rejected her and threw her out. She wouldn't be happy. So we as a church, we who preach the good news, Christ accepting all, the poor and the needy, must accept those who for no fault of theirs are living with HIV. So the church has a role to play. And I'm happy that we here at St. Paul Catholic Church, we have taken up that challenge and that role of embracing all so that we can give them Christ.
The day I disclosed my status in the church, my husband was sitting there. I didn't know he was my husband because we were in the same group. After some months, he came here in the choir. After some months, he called me on phone and decided I should meet him at the church. When I met at the entrance, he said, I would like to marry. I said, are you crazy? I asked you, are you crazy? So I want to marry. I said, you want to marry me? For what? No, I knew I wanted to marry, but the way he came about it, I didn't understand it. How would your people feel? Said, I'm not marrying HIV, I'm marrying you. That's what he said. And so I gave it a try, and then in 2014, we tied the knots.
Despite the years of campaign, Gifty says stigma is still a challenge, especially at the workplace. She tells me many companies would not employ her despite her qualification, adding that workplace abuse and stigma is still high.
It's still ongoing because I'm a volunteer at the Fevers unit at Kolibo, and these issues have been coming to me. People are losing their marriages because of their status. People are losing their job because of HIV. People are going into uniform job during the medicals. When they realize that they are positive, they are not being picked. Meanwhile, when I was in the training school, apart from the malaria I had, everything that college were doing, I was doing.
Section 32(4) of the Ghana AIDS Commission Act 2016, Act 938 states, the HIV status of a person, the partner or close relative of that person shall not constitute a reason to A. refuse employment or B. terminate the employment of that person, except where an employer can prove that the requirement of that employment in question is that an employee must be in a particular state of health or medical or clinical condition. 6. An applicant for employment shall not be tested to ascertain the HIV status of the applicant for the purpose of recruitment, promotion, or any other reason. Fortunately for Gifty Tokonu, the work of advocacy together with family support paid her bills. But since the campaign took a nosedive, Gifty has now turned to poultry and grass cutter rearing. For her, this enterprise has been fulfilling and rewarding. Over 23,000 people have tested positive for HIV in the first half of 2022 alone. Gifty wants the campaign stepped up for infected persons to know that they can live their fullest potential once they stick to the protocols of treatment.
Maybe we have gone back to sleep where we have to wake up and then intensify the education. So I will urge everybody, know your status. And if you know your status and you are positive, live positive life. That is what I've been living. I've been living positively with the virus. Or someone will ask, what is the meaning of living positively with it? I think positively about myself. I have accepted my status. I assess treatment. I adhere to my treatment. My daily life is okay. Go ahead, and the life is so beautiful for me. If I had not told you that I have HIV, how would you know?
The fight against the HIV/AIDS epidemic is a collective responsibility. We all must put our shoulders to the wheel, beginning with our posture and how we perceive persons living with HIV. Shun the stigma, because stigma kills. Ernest Menu, JoyNews.
Now, this is a very heartwarming story of Gifty Tokonu, but it's not the same for a lot of people. Talk about workplace abuse, talk about stigma, fighting it, dealing with all the stress that comes with knowing your status. This morning, we're going to be having a conversation on this particular issue here in the studio, and I've been joined by one gentleman who knows a lot within this sector. He knows how to deal with this matter. He's a Director General of the Ghana AIDS Commission, Dr. Tremi Etiahene. Hello, thank you so much for joining us this morning.
And thank you for having me.
How did you feel listening and watching Gifty's story?
Well, before I answer you, this year has been a good year for the AIDS response. And I would like to use this opportunity to thank our partners who give us money to do the program, and also the individuals and organizations who provide the HIV services to the good people of Ghana. So I pay tribute to healthcare workers around the country for the hard work that they have done to bring us to this stage. We want to thank the Ghana Health Service, National AIDS Control Program, Christian Health Association of Ghana, WAPCAS, HFFG, a whole lot that I cannot mention all of them. But if you can see or hear me this morning, know that the Commission is very appreciative of all the efforts you are making to enable Ghana end AIDS and achieve epidemic control. May God grant us a more productive and rewarding year, which is 2023. I thank you very much. Yes, Gifty's case is quite known to me. I've worked with her for many years, and I thank God for her life. She's someone who is very strong and is very committed to anything she does. Having served as HIV ambassador, we know the good work she did together with the team. But it's unfortunate that it all started this way. And it is quite clear by law that the security agency that did that to her was wrong and actually offended the law. It was not supposed to be. I think they should have adhered to the advice of the HIV counselor at the police hospital. Well, Gifty still has the opportunity to assert her rights if she wants to pursue this issue. But I think she has moved on, and she's doing very well in her business now and in her social life.
But sorry to interject, is that not the problem when we say, oh, let's move on? When you move on in situations like this, then the institutions do not suffer the repercussions of their actions, and then the same thing is visited on another person with a similar condition.
Yes, I said so because I have had a conversation with her, and I know where she stands on this matter.
But I'm asking if that is not a problem.
But the point is, it is a problem. Stigma is a problem. Workplace abuse is a problem. It's not only workplaces, it's also in the home, in the schools, in even hospitals, in the communities. People are suffering stigma. For example, people who, tenants in a house, some tenants will prevent a person living with HIV who is also a tenant. They all pay rent, but they will prevent the person from using, let's say, the toilet or the same kitchen with the other occupants of the house. That is an offense, and that should not be encouraged or supported in any way. And I'm happy that the documentary actually referred to the Section 32 of the Ghana AIDS Commissions Act, Act 938. Section 32, subsection 1 says that a person shall not discriminate against another person, the partner or close relative of the other person, in the workplace on the sole account of the actual or perceived HIV status of that person. Under no circumstance should an employer or co-worker or the union or any member of staff in the workplace discriminate a person living with HIV on grounds of the person's seropositive status. It frowns on the law, and the affected individual can assert his or her rights by taking a legal action against the company or the individual or groups of individuals who stigmatize and discriminate against him or her. The law is quite clear about that you cannot, subsection 2 says that an employer shall not initiate disciplinary procedures against an employee who discriminates against a co-worker on account of the actual or perceived HIV status of that co-worker. So the employer has no right to discipline somebody because the person lives with HIV. Thirdly, an employee who has suffered discrimination by the co-worker may institute legal proceedings against the co-worker and also against the employer if the discrimination comes from the employer. Subsection 4 says the HIV status of a person, the partner or close relative of that person, shall not constitute a reason to refuse employment or terminate the employment.
So that speaks directly to Gifty's, where she was refused employment.
So that is why I said that it offends the law. And whoever did that was wrong and will have to do the right thing. Although it's many years now, if they will either have to compensate her or apologize to her, but they should do something, demonstrably to show that they were wrong.
Right. Doc, so this is Gifty's story, and like you said, it's many years ago. You sit as Director General of the Ghana AIDS Commission. Are there any recent stories that have come to your attention?
Oh, there are many. There are many. In workplaces, in communities, in homes.
Is there any story top of your head that you'd like to share with us?
They are quite similar. There is somebody who went for an interview. She passed, and she went for the health screening, submitted the results, and because the results showed that she was HIV positive, they did not give her the employment, the appointment letter. And they did not give any reason why they did not issue the appointment letter to her. But it is quite obvious that was the main reason. And when they do it that way, it's very difficult to take them on. But as I have just read from the Act, anybody who is going through similar experiences, whether being stigmatized or being discriminated at the workplace, in your house, in the church, in the school, in the community, anywhere in this country, the law grants you right to work. You have the right to work. You have right to health. You have right to education. You have right of free movement, right of association, and all the rights as guaranteed by the 1992 Constitution. Those rights are yours, and you can, assert your rights in that respect. And the Commission will give you all the support. And I would like to use this opportunity to also announce to Ghanaians who are watching or listening to us that if you live with HIV and you are suffering any such mistreatment, you can contact the Commission and we will take the matter up.
Right, Doc. So, and let me just say here that we will be opening the phone lines for some of you who have questions, who have similar stories to share with us about HIV stigma that you have suffered or someone you know has suffered. But Doc, there is a general concern about the dip in the campaign efforts, and this is closely linked to the rise in infections we've seen over the years. I grew up watching Gifty on television. I remember vividly seeing her and a couple others campaigning, talking about AIDS. I heard songs like, it's your life, it's your choice. I grew up hearing songs like, she was HIV positive, waiting to die, so listen to me, save it. I mean, I remember all those campaigns. The music has stayed with me for years. We don't see that again on television at all. At most, what we have is you sitting here talking to me, or other reps or officials of the Ghana AIDS Commission talking, or, you know, supporting or sponsoring programs where they can reach out to people. But we obviously cannot equate that to the power of what happened a few years back. Why aren't we seeing that?
Okay, so those periods you refer to, there were specific campaigns that were running. And those campaigns include the condom campaign, which had a slogan, if it is not on, it's not in. And then a number of musicians also came together and did some songs in support of the work the commission was doing, I mean, to support the AIDS response. And the HIV ambassadors, you know, those that we call ambassadors,
yes.
that was also a campaign. It was heart-to-heart campaign. Now, the heart-to-heart campaign, which started in 2011, 2012, has run over 10 years. Now, campaigns are for specific periods, a maximum of 2-3 years. That is how it goes. And so you do not continue with a particular campaign, you know, for so long. You need to analyze, do assessment to see the impact of the campaign, and then what if there is need to make some changes so that either new campaign will be launched, or you have to make some changes to the existing campaign, modify it to meet the needs of the people, then that is done. But unfortunately, when the funds for those campaigns ran out, we did not have the opportunity to do the necessary research or assessment to be able to do the needed actions that had to take place.
So it's a money problem?
Obviously, yes. It's a money problem. Over the last 2 years, 3 years, we planned to launch condom campaign, but we don't have the money. We've done all the background work, and, you know, launching a campaign, you know, entails a lot of work. And so we need the money to be able to do that. So mainly money has been the challenge, but however, we are also, in the absence of, you know, adequate funds, we are working with the media to at least play some of the TVCs, television commercials and radio jingles for people to know that HIV is still with us. It's still a major public health concern, and we all have to pay attention and ensure that we achieve the national goal of ending AIDS and achieving epidemic control.
Right. So another major concern is the rate of infection among young people, new infections. And some of these young children are reportedly not ones who are born with the virus. They acquire the virus. Of course, young people are sexually active. But the concern is that many of them do not know their statuses, and so they are not putting in the right, taking the right steps towards keeping themselves healthy, body and soul. How about looking at it this way? Social media, the new media, that's where the young people are now. Maybe find a young person, a very young person who is willing to be an ambassador, so that you can reach the young people on that on those platforms while you await money for, the bigger campaign?
Yeah, we are doing that. We are working with NUCS and all its branches or organizations to reach out to young people. I must confess that process has been a bit too slow for my liking, but I now have, in the commission, now has a team that is going to help us, move that effort forward in 2023. It is important that young people are given the opportunity to know their HIV status. The policy indicates that young people above age 16 can have HIV tests without parental consent. But we also know that there are many young people below age 16 who are having sex, and risky sex for that matter. And that is a risk for them acquiring HIV.
And so for such people, parents have to bring them in?
Yes, parents have to bring them in. In the absence of parents, if it is in schools, the school authorities will have to grant the students the permission to participate in such activities, testing. And so we are looking at a number of issues that policy issues relating to young people getting tested so that we can have more of them testing for HIV. But ideally, it is expected that young people will concentrate on their studies or whatever they are doing for a living until they marry. That is what the societal expectation is. But we also know that more and more young people are becoming sexually active. And so we have to make the needed information, the necessary information available to them wherever they are so that they can protect themselves.
Right.
And that is what the Commission and its partners, implementing partners, are doing currently.
Your fight against the virus is multidimensional. So you're doing it from the perspective of reaching out to people, calling them in, come and get tested, know your status, get the appropriate treatment and support if you test positive. But there's also the bit on looking at how we can develop medicines. And I even know about the vaccine trials for HIV that have been ongoing in other parts of the world. But just share with us on the clinical front what our successes are. Are we in the position to quickly adopt some of these new technologies involved in the fight against HIV and AIDS? Yes,
we have already adopted some of them. For example, we have pre-exposure prophylaxis, post-exposure prophylaxis that are available for use by high-risk groups. So we have PrEP, which is pre-exposure prophylaxis for discordant couples and key affected populations.
Can you break it down a bit? So these prophylaxis, what are they? How are they administered, and what do they do?
Okay, so the pre-exposure prophylaxis are meant to protect people who do not have HIV, HIV-negative people who have risks of contracting the virus.
So, for example,
if you have like the discordant couples where one partner has HIV and the other doesn't. The PrEP is given to the HIV negative partner so that it will be protected from infection.
Is it an injection? Is it oral medication?
No, it's a pill.
Okay.
It's a pill. It's the same antiretroviral medicines that, are given to the
negative partner.
Negative partners. We also have the the post-exposure prophylaxis, which we have used for many, many years in this country. Is for healthcare workers, rape victims, and the such, because healthcare workers can easily get accident by way of needle prick or cut during, it can be during, administering, let's say, infusion or something in the clinic. A doctor during surgery may mistakenly cut him or herself, and so it gives them the protection if it's taken within 72 hours following the accident. Right. Rape victims, you never know whether the rapist has HIV or not. And so within 72 hours, any person, any rape victim will have to go to hospital with a police report and receive post-exposure prophylaxis.
Anywhere in the country?
Yes.
It's available?
Yes, any treatment center to be given.
Okay. All right. Doc, would you say we are on track to achieving our 2030 goal of controlling AIDS?
Yes. I was still, if you allow me, let me also say a little more about the new technology.
Oh, sorry about that.
Yes,
I thought you had ended.
There are new medicines which are injectables that would, when one takes, it will maybe 3 months, 6 months, even 1 year, will not need to take antiretroviral medicine. Let me correct myself. These new medicines are long-acting, and so it will take about 3 months, some at 3 months, some 6 months. And there are new ones being developed that will be for 1 year and even beyond. We need to find the money. Yes, our partners would support us to access some of those new drugs, but as a government, as a country, we will have to find money to also add on, because they may not be enough to go around. Because one, it's important that we use some of these new drugs, because the current one is taken every day for life, and many persons living with HIV are not too comfortable with that. Yeah. And so the long-acting ones would enable them to take it once in a while, let's say once in 3 months, 6 months, or 1 year. And that would improve adherence and to treatment. And so we hope that we'll be able to mobilize adequate funds to buy more of such new medicines to support the people living with HIV. But there are several advances ongoing currently. One that I find very interesting and is the antibody therapy. That is more promising, and we are praying and hope that the trials that are being conducted now will be successful, so that it will be developed, the drugs will be developed and made available on the market as soon as possible.
And so this can be taken by anybody?
Persons living with
HIV.
Yes.
Right. Okay. Now, if you're done with the new technologies, can you tell us whether we're on course to achieving our 2030 target?
Yes. It is highly possible for us to achieve the 2030 2030 targets, which are ending AIDS and achieving epidemic control. And there is opportunity to also end HIV transmission because the antiretroviral medicine prevents HIV transmission. It does so when a person is virally suppressed or when the viral load of a person is undetectable. That person will not transmit the virus to his or her partner sexually. And in the same way, a pregnant mother will not transmit the virus to the unborn baby if she is virally suppressed. In fact, the chance of transmitting let's say mother-to-child transmission during pregnancy is very, very negligible. It's just 0.01. And so it is important for persons living with HIV to achieve viral suppression and maintain the viral suppressed status. If they do not maintain the viral suppressed status, then it will defeat our agenda to end AIDS, because that will mean that some of them would progress, will have disease progression and end up having AIDS, and some may end up dying as a result. So treatment adherence is very, very important, and maintaining viral suppressed status among persons living with HIV is also very, very important. But as I was saying, HIV treatment or antiretroviral treatment is a tool for HIV prevention, because when they are virally suppressed, they will not transmit the virus. So we say undetectable equals untransmissible. U equals U. And that should be engraved in the minds of people living with HIV, that as long as they maintain their viral suppressed status, they will not transmit the virus. Right. But that doesn't give them the license to go about, having unprotected sex. We have received a number of complaints from people that their partners live with HIV, but they are going about with a number of women without using protection, without using condom. And that is a concern, because it's a concern because if they are not adhering to treatment, then they have a chance of transmitting the virus to their partners. And so, although EU equals U, you have to maintain, as I said, your viral suppressed status at all times.
Right, and that comes with taking your medication and adhering to treatment.
Exactly.
And that's the good news about HIV and AIDS, because it's gone beyond that point of what we used to see on television, where people were looking extremely skinny. You could literally see just skin on their bones. Now there's medication for you. But Doc, the bigger problem is people do not know their statuses in the first place to even seek treatment. So what is the Commission doing in encouraging and getting more people tested so that people can know their statuses?
Okay, so the test policy is that anyone who goes to hospital should be offered the opportunity to test. So testing is offered in all sections of the health facility. At the OPD, on the wards, at the emergency, it's supposed to be done. Unfortunately, this is not being practiced, in a way that will give us the best results. We are still, in spite of this policy, we still are having a number of people who live with HIV but they never get, diagnosed until they have developed AIDS. And that is concerning because most of them go to health facilities and yet they don't get diagnosed. Whereas in actual fact, it's expected that anybody who walks in there will be given the opportunity to test. And so we encourage our healthcare workers to give the opportunity for people, their patients, to test for HIV. In addition to, health facilities doing HIV testing, we also do community-based and outreach testing, which happen in many communities. We are hoping that effort will be intensified in 2023 and beyond. The young people, there are various ways of testing them. One is for JHS. I think the Ghana Health Service screen the university students, the new entrants, and also the SHS, I believe, they are also screened. We will have to make sure that HIV is added to the various screening done at those levels so that we will have a way of knowing and supporting people, especially young people who live with HIV. So HIV test is free and you can get it in any health facility, at least most of them. Even CHIPS compound, you can get HIV test and it is free. And so feel free to test, be bold to test if you have never tested. If you have tested, it doesn't mean, you can still test if you've tested before. Some people tested 5 years, 10 years ago, and they have never tested. No, at least you should test every year. If you know your risk is very high, then you should at least test every year. But one of the problems we are having is that when some of them test positive, they think that the result is incorrect. And so they will go to another place to test. So the repeat test amounts to nothing because you will not get the type of test being done now is done thrice, or the confirmation is done twice. And so once your test results has been confirmed, you will not see any different results wherever you go.
At another facility.
So there is no need for repeat testing. Okay. Once you are tested, and if you are told you have HIV, please immediately accept treatment, because early treatment gives better results and good health outcomes than late diagnosis.
My guest this morning is Dr. Tremie Chiahene, Director General of the Ghana AIDS Commission, and I'll be wrapping up with him shortly, especially on the funding and what you hope to do about the overdependence on international donors. But now, let me take your calls. That's if you have any questions for Doc, or if you have any suggestions, or if you have any story of stigma that you'd like to share with us. The number to call 0302-211-691, 0302-211-691, and we'll be glad to take your thoughts and share it with the rest of the world. So, Doc, on the bit of funding, that has been a long time problem. Like you mentioned, even with the time that you were doing campaigns and all that, you were being sponsored by international agencies and donors. What exactly is the problem, and how do we address it when it comes to funding our own projects with the Ghana AIDS Commission?
Well, as a country, we need more than $130 million equivalent for the AIDS response every year. And government of Ghana doesn't have that money for the AIDS response. So donors actually pay the biggest part of it. Now, the funding requirements, because we do not have adequate funding, we have to prioritize. And so antiretroviral medicine and other HIV commodities like test kits, reagents, and other supplies for laboratory work are high priority.
Doc, permit me, please. Okay. I'll ask you to hold your thoughts there. Kwame is joining us from the Central Region. Hello, Kwame. Let's hear you.
Yeah, good morning. I want to ask Dr. Tuahim, why is it that we are having ambassadors, 8 ambassadors, who are efforts? I've seen Jijo and then another lady. It comes with certain stigma in itself when you tend to alienate only one region. I mean, it's not too good. I'm not too sure. You would have to look at it. In the UK, they don't even advertise HIV. But they have a lot of HIV cases. We know where the centers are. But in the Ghana case, the TV is inundated with this HIV stuff, which is a bit not too good, I would think. I don't know what your views are, but I'm not too happy with some of this.
Right.
One, that's the stigmatization of a region as having them as only 8 ambassadors. It comes with the ladies not being attractive to other people because there's a suspicion of they carrying HIV.
Right,
so
point well noted. I'll have Doc respond to that. Doc?
I think it's a misconception. It's a misconception because there was no ethnic element in the criteria used. The 4 people who were appointed as heart-to-heart ambassadors were appointed on the basis of, volunteerism. They volunteered to do the work. As Gifty said, she herself, long before she was appointed, she herself declared her status. Nobody forced her. She felt compelled to make it known to the whole world. Jijo, Gifty, Reverend Azuma, and his late wife, may she rest in peace, and Charity. Charity is not an ever, but they offered themselves to support the response. We now have several persons living with HIV who are doing, similar activities, although we have not appointed them as ambassadors. But they are doing exactly what the heart-to-heart ambassadors also did. And so, please don't misunderstand the work that these people are doing. It has nothing to do with ethnicity. It has nothing to do, there is no intention to stigmatize Volta region, if that is what you want to say. In fact, if any region should complain about stigma, it should be Eastern region, because it has been the epicenter of the epidemic right from the beginning until recently. And so there is no ethnic motive about the appointment of these ambassadors.
Great. Kwame, I hope your question is answered. We have another caller. Hello, Abendao. Let's hear you, please, quickly.
Good morning, Dennis, and your host.
Good morning.
Yeah, hello.
We can hear you, Abendao. Please go ahead.
Yeah. I want to know if taking your blood samples for medical tests, they can also test your HIV status without your knowledge. For instance, maybe at a hospital, maybe you are sick and they have taken your blood samples for medical tests, and they have also tested the HIV in addition without your knowledge.
Right. Doc will respond to that. Thank you for calling, Abendao. Doc.
Yes, it is possible, but it's not supposed to be. The law frowns on that. They will have to seek your consent before they test you for HIV.
Right, Abendao. So that's it, straight to the point. We have another caller, Emmanuel, joining us from Kumasi. Hello, Emmanuel, let's hear you.
Hello.
Hi, Emmanuel, we can hear you. Please go ahead.
Good morning. I'm Emmanuel from Kumasi. What I want to know is, last time I had a teacher.
Emmanuel, can you please speak up a bit? It's difficult hearing you.
Last time I heard the teacher saying it wasn't positive HIV. But what is different from what the woman is saying right now? Because it could be that this woman is negative and she's saying it's positive. That is what I want to know. Thank you.
All right, Doc. So, I mean, we've heard all about it. He's making reference to one of your former ambassadors who made a lot of claims later, saying that she was an HIV positive and a lot. So, it's created a bit of mistrust in the system, as you may anticipate. So he's just saying that what's the guarantee that Gifty is actually HIV positive? I mean,
well, Gifty herself has declared that she is HIV positive, and she has the results which she made reference to, and so she is indeed HIV positive. Jijo, if you followed Jijo's story, you know that after declaring that she was not HIV positive but was compelled to say so by the commission, she came back on many occasions to say that indeed she is positive, but she had to make those statements out of frustration and whatever. She even went to the extent of doing tests publicly on TV together with her children, which was not supposed to be, but she did it just to indicate that indeed she is HIV positive. So all the heart-to-heart ambassadors are HIV positive. They have their test results, and they are on treatment. That is why Gifty looks so beautiful and strong. So is Reverend Azuma, so is Charity, and even Jijo herself. They are all on treatment and adhering to treatment.
right. Okay. So, Doc, if there's no other caller, just wrap up on the bit of funding and what we need to do to bridge that gap.
Okay. So the funding dynamics over the last 10 years have changed. We have been, overly donor dependent. Now, donors themselves are saying that no, there should be the burden share, and therefore countries will have to pay 60% of the cost of HIV program, whilst donors continue to support with 40%. And that is what is prevailing around the world, including Africa, where majority of HIV, persons living with HIV is. And so Ghana is yet to meet that 60% threshold. And we are working with government to address that. Very soon, the National HIV Fund will be launched next month, and we will know what government is putting on the table. And then the government cannot do it alone, considering the current economic situation in the country. And so we will need the support of the private sector, of various, charities, philanthropists, and in fact, every individual should make it a point to contribute to the fund so that we can find money to do the things that the public wants the commission to do, like having, AIDS campaigns, so that people get to know about HIV, make the services available, testing services, treatment services, self-testing, pre-exposure prophylaxis. It's not supposed to be limited to only a few group of people in the country. It should, if we have the funding, it should be made available to everybody. But because we don't have the funding, it's being restricted. And so we need the support of all Ghanaians to be able to resource the AIDS Fund so that we can provide the needed services for everybody who needs them.
Thank you very much for your time here this morning. Dr. Tremi Etiahene is Director General of the Ghana AIDS Commission. And this morning we've been talking a lot about the Commission's fight against the virus, the funding issues. And Doc, I must say that there are a lot of other things to explore when it comes to HIV and AIDS, but today we decided to focus on these. Hopefully we'll have you here another time where we can talk about vulnerable groups that are at more risk of contracting the virus and what they must do to protect themselves.